Dear students, we have discussed fracture of the upper limb. We have started from the shoulder girdle to the hand. That is finished now. So today we will start fracture of the lower limbs. Start with the topics in which there is acetabular fracture, pelvis fracture, hip dislocation, proximal femoral fracture, femoral shaft fracture, fracture of the tibial plateau, tibial shaft fracture, and last one is the ankle fracture. So we will discuss all these fracture one by one. So in case of fracture pelvis, the mechanism of fracture is in the lower limb is result of high energy trauma, except in elderly patient or diseased bone in which there is pathological fracture. So types of fracture are depend on the position of limb during impaction or magnitude of force applied. That means what was the position of the leg when it happened an accident or when a force was applied to that area. Management of the pelvis fracture. The proper way to treat patient with the high energy trauma is to look at the patient as a whole, not the injured limb. So remember that treat the patient, not only the limb. So the aim is to treat such patient to save life first, then save limb. So remember, save life first, then save limb, finally to save the function. We have to follow A, B, C, D, like airway, breathing, circulation, and deformities. So deformity or the fractures come at the last after A, B, C. Then you go to the fracture of the pelvis. Is high energy trauma as a result of motor vehicle accident or fall. It is classified according to the Marvin type classification. So there are type A, which is stable fracture. Function of the pelvis is not involved. I am in lecture दे रहा हूँ. So, according to the type A is stable fracture, and the fracture of the pelvis not involving the ring, and the type A2 is a stable, minimally displaced fracture of the ring. So this is the pelvis, which shows there is fracture, but this fracture is outside the ring. So this is the ring which is not broken. So this indicates the fracture outside the ring, which is called stable fracture. Then type A, type B, and type C in the diagrams. So type A is a stable fracture. There is a ring which is intact. In type B, this is an open book fracture. You see, the inferior pubic rami is open from here, as well as there is opening of the sacroiliac joint. So this is like a book is open. Then this part of the, consider a page which is separated from the book, like you open a book. Then type C fracture is unstable vertical fracture, in which there is fracture of the inferior pubic rami, superior and inferior, and fracture of the sacroiliac joint or the pelvic bone from here. So in this patient, fracture of the one half of the pelvis which is shifted upward. So when it's shifted upward, it's called vertical shear fracture, and it is unstable fracture. Type B is rotationally unstable and vertically stable fracture, in which there is open book fracture, which I show you in the diagram. Lateral compression, it means the pelvis is compressed from the both side or one side, and there is fracture of the pelvis. And lateral compression from the contralateral side. You see, this is you can say this is an stable or unstable fracture, as there is pubic rami is open and the ring is open, and there is some injury to the sacroiliac joint as well. So it is an unstable fracture like open book fracture. Type C fracture is rotationally and the vertically unstable. It may be unilateral, it may be bilateral. It is associated with acetabular fractures. This is a picture of unstable fracture. You see here there is open book from here, and it is vertical shear as well. So it is displaced high up. If you see the pubic rami position, and sacroiliac joint is open and it is going upward as well. So this is unstable fracture. Regarding the management, the treatment of the fracture should be aggressive one. You have not to wait regarding delay of the treatment. Immediate treatment is started as you know that there is fracture of the pelvis. The patient will come in emergency with the pelvic fracture, will be in the severe pain, and the patient is going into shock or received in shock. So immediately make the patient pain free, start IV lines, and send the patient to X-ray department or do the X-ray, portable X-ray in that area. The special X-ray which is required, AP view of the pelvis, inlet and outlet view of the pelvis, and CT scan may require in some of the cases. This is the X-ray of the pelvis, which is severely injured patient. You see here fracture of the inferior pubic rami, fracture of the superior pubic rami. Sacroiliac joint is a little bit displaced. If you see this sacroiliac joint, you see this area is very narrow, and here it is widening of the sacroiliac joint. These are different X-rays, inlet view and outlet view. These are the picture which show displacement of the fracture in the inlet view and in the outlet view as well. Inlet view is the X-ray beam is from the head side and the cassette is down to the table, and the view will come from that inlet view. And outlet view is done by the film is on the down, and the X-ray machine is 45 degree from the lower side. So this will give you further detail of fracture of the ring of the pelvis. So aggressive treatment start with the ABCD. You have to obtain the X-ray, AP pelvis, inlet view, outlet view, and if needed do the CT scan as well. Think in systemic approach. Specific treatment. What is specific treatment for that? In type A fracture, symptomatic treatment. If the patient is stable, then do the patient pain free. Stable means his blood pressure is maintained, vitals are normal, patient is in pain, and the ring is not open, minor fracture. So just take the symptomatic treatment. But in case of a severe injury, you have to stabilize the patient, prepare for surgery, open reduction, internal fixation with the plates or screw or external fixator. In type C, open reduction, internal fixation with plates and screw, both AP and lateral side. When the patient is in emergency, make the management, protect primary blood clot by early pelvic splintage and prevention of excessive movement. पेशेंट को जितना मूव करेंगे उतनी ब्लीडिंग ज़्यादा होगी, जितना एक जगह पे रहेगा मूव नहीं करेगा उसकी ब्लीडिंग कम होगी. एंड यू हैव टू स्टेबलाइज द पेल्विस विद ए शीट और ए pelvic belt. Give him plenty of IV fluid. Early blood transfusion is required. Early fresh frozen plasma is required. Patient may need platelet transfusion and cryoprecipitate. Prevent hypothermia and acidosis. Stop other bleeding site and stabilize pelvis. So you have to go step by step. Splintage, IV fluid, blood transfusion and blood particles. Prevent hypothermia. Stop other bleeding point, like if there is bleeding wound on the leg or arm, just do apply bandage and then stabilize the pelvis. This is a pelvic belt. We just apply a bed sheet of the patient just from one side and the other side, or a leather belt is available which can be tied from side to side. This is an external fixator which is applied in emergency. Just put two pins from here, one pin from other side and do fixator, and here is the abdomen of the patient. You see, here one pin here, one pin here. It will compress the separated part of the fractures. It will make compression of that area. When the compression, the bleeding will stop and it will help to hypotension of the patient. In some of the patient, you have to apply this plate and screws. This patient was open book fracture in the pubic rim eye. It was separated part. This is the line of incision which close with the staples. A plate is applied on the superior pubic rim eye on the both sides, and the sacroiliac joint is compressed with the screw. This is applied with the help of image intensifier. And you can see as well, this patient was having a polytrauma, so there is also femur is fixed with the nail as well. What are the complications of pelvic fracture? In pelvic fracture, there is loss of blood, so there will be hemorrhage, and this hemorrhage may be life-threatening. There may be injury of the bladder and bowel injury, because all the intestine and the bladder is in the lower abdomen part, can be injured. Neurological damage can occur in case of the sacral fracture. Obstetrical difficulties, persistent sacroiliac joint pain later on, post-traumatic arthritis of the hip with acetabular fracture. So thank you very much for listening this pelvis fracture.